There are more than 30 Medicare plans available right here in Maricopa County. 30. And almost every one of them looks great on paper. They all promise $0 premiums, dental, vision, gym memberships, the works. But here's the part that nobody tells you. The wrong plan in this county can lock you out of your hospital, kick your cardiologist out of your network, and turn your prescriptions into a bill you can't afford. All before you even realize what happened. I'm Andy Childs. I'm a Medicare broker right here in Mesa, Arizona. I've helped hundreds of people across the East Valley pick the plan that actually fits their life. Not the one with the prettiest brochure, but what works. In the next 10 minutes, I'm going to walk you through the exact process I use with my Mesa clients. By the end, you'll know how to choose a Medicare plan the way a local broker chooses one, instead of guessing. Now, here's where I'm going to break with what most Medicare videos tell you. Most of those videos start with the plans. They explain Medicare Advantage, Medigap, Part D, and then they say, now pick one. That's backwards. That's how people end up on the wrong plan. A plan is just a tool. The right tool depends on what you're trying to do. In Medicare, that means which doctors do you want to keep? Which hospital do you trust? Which pharmacy do you actually drive to? And which medications are you on right now? When I sit down with a client, I don't open the plan list first. I open their list first. And the right Medicare plan reveals itself almost every single time, just from those 4 pieces of information. That's the whole game. So let's go through it the right way. Let me show you why this matters, and let me make it specific to where you live. Picture this. You're 65. You live off Hickley and Southern, and you've been seeing the same primary care doctor at Banner Desert for 15 years. Maybe you also see a cardiologist there. You're approaching enrollment, and the mailers start showing up. You see a plan with a $0 premium, a free gym, $1,500 dental allowance. Looks like a no-brainer. You sign up, January hits. You go for your annual checkup. And the front desk tells you your doctor is not in your network. You drive to the cardiologist. Same thing. You call the carrier and they tell you your closest in-network specialist is in Avondale. 45 minutes one way in Phoenix traffic. That's the kind of situation that lands on my desk every week. Not because the plan was bad. The plan was fine. It was just the wrong tool for that person's life. And once you're locked into a Medicare Advantage plan, you usually can't switch until the next enrollment window, months away or a year away. That's what this video is here to prevent. Let me show you exactly how to choose the right plan the first time. The single most important rule I follow with every Mesa client: doctors first, plans second. Before we ever pull up a single plan comparison, I ask 3 questions. Who's your primary care? Which specialist do you see? And which hospital do you want to be admitted to if something goes wrong? That's it. Those 3 questions narrow your plan list from 30 plus down to maybe 5 or 6, sometimes even fewer. And here's why this works. Every Medicare Advantage plan in Maricopa County is built around a network. The plan negotiates with specific hospital systems and specific doctor groups. And you only get full coverage when you stay inside that network. If your doctor isn't in the network, you either pay out of pocket or you switch doctors. Most seniors don't want to switch doctors. They spent years building that relationship. So the plan has to fit the doctors, not the other way around. Here's a hypothetical that I see play out all the time. Let's say someone in East Mesa near Power Road has been seeing a primary care provider at Banner Baywood. They've been there for 10 years. They've also got a knee surgeon they trust at Banner Desert. If they pick a plan that's built around HonorHealth or Dignity Health Network, both of those doctors are going to be out of network from day one. The plan might still pay something, but the costs spiral fast, and the patient ends up either paying full or starting over with new doctors. Pick the plan that fits the doctors you already trust, not the other way around. That alone solves about 70% of the bad enrollments I see in this market. There are three big hospital networks that dominate Medicare Advantage in this part of the East Valley: Banner Health, HonorHealth, and Dignity Health Arizona. Most plans contract heavily with one of those three, and only loosely or not at all with the other two. Banner is the biggest footprint in Mesa. Banner Desert, Banner Baywood, Banner Hart, and Banner Gateway just over in Gilbert. If you're North Mesa, Central Mesa, or anywhere along the 60, there's a strong chance your doctors and your preferred hospital are inside the Banner system. HonorHealth has a smaller footprint here, but it does show up, especially if you got family in North Scottsdale or you used to live up that way and you kept your doctor when you moved. Dignity Health, which includes Mountain Vista Medical Center off Baseline, is the third major player. If you're in Southwest Mesa or you've used Mountain Vista in the past, you're probably tied into that network. The mistake people make is assuming all Medicare Advantage plans cover all hospitals. They don't. You could live 3 blocks from Banner Desert and pick a plan whose closest in-network hospital is 20 miles away. So here's what to do. Before you pick a plan, write down, literally on a piece of paper, the name of every doctor, specialist you want to keep. Write down the hospital you want to go to. Then call any plan you're considering and ask, are these doctors in network for this specific plan in 2026 at this specific zip code? Get it confirmed before you enroll. If they can't confirm it, that's your answer. Move on. After Doctors First, I run every Mesa client through the same 4-question filter before I recommend a plan. If you do nothing else with this video, write these down. These 4 questions get you 90% of the way to the right answer. Question 1, doctors. We just covered it. Who do you see and who has to stay in network? Question 2, drugs. What medications are you taking right now? Every Medicare plan has its own formulary. That's the list of drugs it covers and tiers it puts them on. The same medication can cost $5 on one plan and $150 on another. All in the same county, all in the same month. Before you pick a plan, run your full prescription list through the plan's drug pricing tool and look at what your year 1 cost actually is. Not the premium, the total cost. Premium plus copays plus deductibles. Question 3, dual eligible. Are you on a Medicare and Medicaid, or do you qualify for extra help? If yes, and a lot of folks in this county are, you may qualify for a D-SNP plan, which is a completely different category with extra benefits most people don't know exists. Transportation, over-the-counter allowance, expanded dental. If you skip this question, you can leave thousands of dollars on the table every year. I covered extra help in detail in the previous video, and the link's going to be in the description if you missed it. Question 4, dollars. What can you afford in a worst case year? Every Medicare Advantage plan has a maximum out-of-pocket limit, a MOOP. In 2026, those caps run from anywhere to $3,000 to over $8,000, depending on the plan. If you have a serious health year, surgery, hospital stay, cancer treatment, that cap is the most important number on the plan. Not the premium, not the dental allowance, the worst case ceiling. Doctors, drugs, dual eligible, dollars. 4 questions, run any plan you're considering through that filter. And the right one in this market almost always becomes obvious. Let me bring it together. Choosing a Medicare plan in Mesa is not about finding the plan with the most extras. It's about finding the plan that fits your life, your doctors, your hospital, your medications, and your worst case year. Start with your doctors, map your hospital, run your prescription through the formulary. Check whether you qualify for any dual eligible or low income programs, and look at the maximum out-of-pocket number, not just the premium. Do that, and you've narrowed the field to 2 or 3 plans before you ever talk to anyone. That's how a local broker thinks about this, and that's how you should think about this as well. If this video helped you, subscribe to the channel. I do a new Medicare video every Tuesday and Friday. And the next few are going to be especially important if you are approaching your open enrollment period. And if you live anywhere in Mesa, the East Valley, or really anywhere in Arizona, and you want help running your own 4-question filter, that's what I do. There's a link in my description and also my phone number, so please reach out. Working with me costs you nothing. The carriers compensate brokers directly. You don't pay me ever. My job is to actually answer your questions until you feel good about your choice. I'll see you in the next video.